Each year, millions of people are diagnosed with skin cancer, one of the most common forms of cancer globally. When caught early, it is highly treatable. And now, a new AI technology being implemented by the National Health Service in England aims to triage patients quicker, freeing up dermatologists' time and hopefully saving lives. Could AI be the future of skin cancer diagnosis?
A mark appeared on my leg, a spot. I didn't take any notice of it, just left it, thought it would go away. But actually I did think it was a bite, an insect bite. But it began to change a bit, so I thought I'd better have this looked at. The receptionist at the local doctor said, would I consider AI? Which surprised me because I didn't know there was such a thing. But yeah, I'd try AI. The person who I saw was not medically qualified, which I was disappointed. I expected somebody medically qualified to immediately tell me what was wrong with my leg. And all she had was a phone. She took a load of pictures and assured me that I would hear if it was not a nice outcome. I came home. I grumbled to my husband that it wasn't what I was expecting. By 7 o'clock that evening, I'd had a phone call and I took back all my grumbles because a very nice man explained to me that AI had picked up that this was a cancerous growth and it needed to be dealt with quite quickly.
This new technology, known as DERM, or Deep Ensemble for Recognition of Malignancy, was developed by Skin Analytics.
The way that it works is we get dermoscopic images of patients' skin lesion. The AI is able to analyze that and identify malignant lesions, pre-malignant lesions, and then benign lesions. From collecting the image to getting an answer is a matter of seconds. The longest time is actually the uploading of the image within the hospital environment where the Wi-Fi or the mobile networks are always pretty poor. The AI is decomposing that image and looking for all sorts of little features that may indicate cancer in a very similar way to a dermatologist would, but in more abstract a way. So as the AI gets down to more deeper levels of analysis, it starts to find abstract things that we would find very difficult to explain, but it gets very exciting because it's starting to find things that we as humans don't yet know are indicative of cancer. At some point, you're asking the artificial intelligence to make decisions on things that humans can't, and trying to explain it, that's one of the things that I get a little bit frustrated by, because artificial intelligence is a statistical science. We should use statistics to describe it and make sure that it works. The explanation of how it works has to come later.
Earlier this year, DERM was approved by the National Institute for Care and Excellence, or NICE, for a trial in the NHS.
For the skin cancer pathway specifically, we know that there are more than 1 million referrals per year to the pathway, and the majority of them are actually non-urgent referrals. Seen from the evidence that only 6% of these referrals are actually need to be in the pathway. That also obviously create pressures for the NHS. We know that there is a backlog, approximately 500,000 backlog of elective referral appointments. We know that there is staff shortages. This technology, DERM AI, was something that our topic Intel picked up as having that promise and that early evidence.
The NHS is exploring other uses of artificial intelligence, diagnosing COVID-19 from chest imaging, providing funding via the AI in Healthcare Award, or even NHS 111 trialling artificial intelligence to help with triage. It is clear that the Institute and many others around the world see that it has a role in the future of healthcare. DERM shows early promise in triaging skin cancer, but raises many other issues around how patients access healthcare.
When I see a patient with skin cancer, it first starts with the history. You want to know how long it's been there. You want to know if it's evolving over time or changing over time. You want to know if it's itchy, if it's painful. You also want to know if they have personal or family history of skin cancer and if what their sun exposure history is. So you put all that information together along with what you see on the physical exam to generate a thoughtful clinical judgment, and that gives you the diagnosis of whether something's benign, non-cancerous, or malignant, a skin cancer. I think the big concern, especially amongst dermatologists, is by removing kind of the human element. Dermatology is a lot of touching and feeling. When you remove that out of the equation, I think you lose that component. I think the patient misses that as well.
Along with this, many AI models have been trained primarily on images of lighter skin tones, raising concerns about artificial intelligence's diagnostic bias.
Those biases are super important when we speak about skin cancer, because we know populations with skin of color tend to present at later stages. Black patients have lower survival rates compared to their white counterparts when they're diagnosed with melanoma. And so you have a bias data set that could potentially exacerbate disparities in outcomes rather than improve them.
People with different skin tones is a very challenging and very important issue in dermatology. And I think in all of medicine, we have a long history of seeing that the outcomes for those patients are not as good. When it comes to skin cancer, one of the challenges that we have is that the incidence of cancer is dramatically lower in darker skin tones. And so there just isn't as much of the positive cases to be able to sense check whether or not the technology works. Somewhere between 2 and 4% of patients who present in our pathway have identified as having darker skin, but the incidence of cancer in those groups is very, very low. And so we're very fortunate to have found 100% of the cancers in that pathway, but because those numbers are so low, we can't make any statistically significant claims about how the technology performs.
There's a question mark there of how well it will perform when it's used more widely in the NHS. And we have a lot of variability in different parts of the country in terms of these populations. So our committee has recommended that for these patients, for these people, there needs to be an additional oversight of a healthcare professional, at least for early use of the technology as part of the individual NHS trusts.
The NICE assessment will take place over the next 3 years as they gather evidence to test the reliability and value of this specific tech.
People are naturally going to be concerned about using AI, and I think the challenge is that in many fields it doesn't work very well, and there's a lot of data to suggest that it's not ready. And I think what I would say is that it's important to have a look at the data that sits behind it. And the amount of patients that we've seen now, the amount of clinical studies that we've run, all the post-market data that we have, over 15,500 cancers, shows that the AI is ready to make these decisions.
Artificial intelligence is not replacing doctors, but it is beginning to reshape how we detect, interpret, and respond to disease.
The future is very promising, but I think we have a long way to go. It's definitely not prime time. Dermatology has a long history of excluding images of people of color, and I hope that we don't make that same mistake with AI, because the stakes are even higher. And so I hope that as we build these tools, that we're very intentional about including people and diseases that have been excluded in the past.
I think the hope is that when it comes back to our committee in 3 years' time for reassessment, to have much more evidence, hopefully thousands of patients, evidence for our committees to consider, more evidence on people with brown and black skin, and more evidence generated on the impact it has on the pathway, confirming the good message that comes from early evidence.
As a 60-year-old person, AI is a brave new world. It was something that I didn't feel would ever be involved in me in my life, and now I've been proven completely wrong. I have subsequently gone back for 3 other skin things that I have not been quite happy about, which I've probably ignored in the past, realising how easy it was to go and make an AI appointment that didn't block up the doctors, didn't, in my mind, waste anybody's time, and was convenient to me. Choose the time, choose the place, go. And to alleviate a very crowded, overworked NHS, it's a win-win.